branches that are going to supply our thoracic wall, but we also have branches off of our subclavian and other arteries located in our thorax. So our internal thoracic arteries are supplying our anterior thoracic wall, and they come off of the subclavian arteries. And they actually come down and travel on the posterior aspect of our anterior thoracic wall. Did you guys follow that?
Can you say it again?
Yeah. So they run on the posterior aspect of our anterior thoracic wall. So if you're looking at like the anterior thoracic wall, okay, and you flip it over to look posteriorly, the artery running alongside the sternum are internal thoracic arteries. Okay, you could say they're running on the deep surface of our anterior thoracic wall. Does that help? Does that make more sense? They're deep on the front wall. Okay? Okay. I think it'll make more sense in lab. We also have our anterior intercostals that are going to branch off of the internal thoracic artery. So we have anterior intercostals and we have posterior intercostal arteries. So our internal thoracic is going to come down on the deep surface of our anterior thoracic wall, and it's going to give off branches that are our anterior intercostal muscles. So if you're looking at the anterior thoracic wall, the structures of Van are going to be your anterior intercostal vein, your anterior intercostal artery, and your intercostal nerve. Off of our thoracic aorta, our descending thoracic aorta, we have our posterior intercostal arteries. Okay? And our posterior intercostal arteries are going to make up the posterior thoracic wall's van. Does that make sense? I used a lot of like anatomy orientation, so you can re-listen to it, you can ask me again. And we have our posterior thoracic wall where our vertebrae give off our ribs, and then our anterior thoracic wall has our sternum on it. Okay. And then internal thoracic is going to split into two arteries. One of them is going to remain in the thorax, and that's our musculophrenic artery. Our musculophrenic artery is going to supply our diaphragm, okay, and our last two intercostal spaces. But our musculophrenic is kind of coming out like this, and it's going to supply parts of our intercostal spaces. The other artery is the superior epigastric, which is going to remain going straight down, and we'll talk about it when we get to abdomen. Okay. Our venous drainage of our thorax is through our azygos vein, or azygos vein, however you want to say it. It's located on the right side on our posterior thoracic wall, so it's located like just in front of our vertebrae on the right side, okay? And it's going to come up and drain into our superior vena cava. So we can see here, we have our azygos vein going all the way into our superior vena cava up there. Okay, so this is the azygos. Okay. We have collaterals coming in. So since it's on the right side, our intercostal veins will drain directly into the azygos vein on the right. They'll drain into accessory azygos veins on the left, which will carry blood over to azygos, so that all of the blood from the thorax is basically going up to the superior vena cava through our azygos vein. Cool? Okay. Our azygos vein is going to drain our posterior intercostal veins, okay? Our internal thoracic vein is going to drain our anterior intercostal veins. You can see that right here. And our anterior intercostals are going towards internal thoracic. Okay. So if we look at our contents of our thorax, we have our lungs, our bronchi, The inferior border is our diaphragm. Okay, we have our airway. We have our pleural cavity. So do you guys know the pleura that surrounds the lungs? We have a parietal and a visceral pleura. Okay, and then we have our outer cage of our thorax, which is made up of the ribs and the muscles. Okay. The thorax, you can kind of think of is this one big like mediastinum. Okay, and it's this like central portion of the pleural cavities. So in between them and then around them. Okay, it goes from the sternum all the way back to the bodies of our vertebrae. And then it also goes from our superior thoracic aperture, where our first rib is located, so the opening into the thorax, down to our diaphragm. Okay, and it's divided into different divisions. So we have a superior mediastinum, an anterior, middle, and a posterior mediastinum. And we have a bunch of structures that make up the contents of our mediastinum. Okay, so we have our thymus, which we know no longer really exists in adults, right? We have our brachiocephalic veins here. Okay, our superior vena cava located here. Our aortic arch and our branches are also part of the mediastinum. Okay, we have our trachea, which is coming down here. Our esophagus, which continues down. We have our phrenic nerves. Do you guys know what the phrenic nerves do?
Carry blood away from the kidneys.
Nerve. We're in the thorax. They're gonna travel all the way down. Phrenic, all the way down to this structure down here.
The diaphragm?
The diaphragm. So phrenic nerve supplies the diaphragm. We have a right and a left phrenic that are going to supply the diaphragm.
That's right.
We have our thoracic duct and our lymphatic. So this green structure right here is the thoracic duct. That's going to carry our lymphatics all the way up into our blood supply. We have our pericardium and our heart that's been removed, but it would be located here. So you can see like a part of the pericardium, I think, still attached to the diaphragm. We have our nerve plexus and our vagal plexus kind of surrounding the esophagus. We have the azygos vein right here. Our sympathetic chain you can't really see in this image, but it is located on both lateral aspects of our vertebral body. Okay, our sympathetic chain is how sympathetics travel down and up to the head and neck so that we can have a autonomic response. Our vagus nerve is right here. So our vagus nerve is cranial nerve 10, and cranial nerve 10 does what? Pretty much of what?
Parasympathetic of the heart.
Parasympathetic of the digestive system, pretty much all the way down to like the transverse colon. So it's taking care of a lot of parasympathetic in the body. And then we also have fat surrounding the heart and our structures in our thorax that make up the mediastinum. There are more, shockingly enough, that you guys will learn about, and they will be separated into like superior, middle, anterior, and posterior mediastinum contents next year, but this is like a general, the entire mediastinum contains these structures, okay? Some of them are located in the posterior mediastinum, some are located in the anterior mediastinum, some of them are located in the middle, and some of them are located in the superior. Cool? Okay. So when we talk about breathing, okay, we have inspiration or inhalation. This is how we like expand our lungs to get air in, okay? And the way we do that is the contraction of our diaphragm and our external intercostal muscles. So when we breathe, majority of our breathing is due to the diaphragm contraction. So when the diaphragm is relaxed, it's that curved shape, like this, the way we think of our diaphragm, kind of like running like this. When it contracts, it actually flattens, okay? And it contracts due to its innervation from the phrenic nerve. It flattens, increasing the volume of the thoracic cavity, right? And then air can flow in and our lungs can expand. And this is responsible for almost 75% of the air entering into the lungs. Okay, so the majority of our inspiration is due to the contraction of our diaphragm. Our diaphragm is innervated by the phrenic nerve, and the chord levels of the phrenic nerve are C3, C4, C5. So there's like a little rhyme to make that stick. It's like C3, 4, 5, keeping the man alive. Okay. Have you guys heard of the dermatome map? Okay, so if you have damage to your phrenic nerve, we have referred pain. Do you guys know where the referred pain is located?
Like your visceral organs?
The shoulder. Yeah, the shoulder. It's from damage to the phrenic nerve. So if the diaphragm is like the nerve contracting the diaphragm is damaged, you'll have referred pain to your shoulder. Your pericardiophrenec nerves also branch. So you like heart attack down the arm.
Are you saying referred pain
Meaning
is only found in the shoulder? Like,
so a lot of people come in, like, if they have damage to their phrenic nerve, they'll come in and say, like, you know, I'm in a lot of pain, my shoulder hurts, I'm having trouble breathing. I don't know, I'm not a doctor, but I'm assuming that's like the symptoms that they would come in with. It's not shoulder pain, it's just kind of projecting there as like a pseudo place for pain, but what's actually happening is their phrenic nerve is damaged, innervating. Because the dermatome, the sensory component from C345 is the shoulder. That's where the dermatome map is. Okay, our external intercostals are also responsible for inspiration. Okay, and when they contract, so think about if they were to contract up, they would pull the ribs up and kind of open, so everything's angled down, right? Like this. This is how our ribs travel. When the external intercostals contract, they're going to open and elevate our ribs, so creating even more space for our lungs to expand, and that's about 25% of our breathing they are responsible for about 25%. Does that make sense? So basically we're opening up the space in our thoracic cavity so that our lungs can expand and air can flow in. Well, air can flow in and our lungs can expand, right? Cool. So we have our diaphragm is located inferior in our thoracic cavity, and because it contracts and flattens, that's how we have inspiration. And this is our diaphragm. Okay, so we're looking at an inferior view of our diaphragm. So you're looking at a person from the feet up towards their head. So this is from like the abdomen, essentially. And our diaphragm has different openings for structures to pass from our thoracic cavity into our abdominal cavity. Okay, and when it contracts, it pulls out so that it flattens. Does that make sense? It's like it's originating, you can think of, it's like originating out here. So everything pulls towards the origin. So if everything pulls out that way, it's gonna flatten out. Okay. Our external intercostals are also responsible for inspiration, and they're located out here. They run like this. Okay, and they don't actually come all the way into the sternum. They kind of end on the lateral aspect of our ribs, like right in here. Okay, and they contract to kind of elevate the ribs and open up that space in the thoracic cavity. Do you have a question? this is another image of our diaphragm. And you can actually see the structures passing through. So our inferior vena cava has to pass through our diaphragm. Our esophagus has to pass through our diaphragm. And so does our aorta, because we have an abdominal aorta as well, right? So there are openings for those structures, and then we have this muscular portion of our diaphragm. And then this tendinous portion called the central tendon. So you'll see this like big white structure in lab. That's the central tendon of our diaphragm. Okay. It's going to attach kind of into our vertebrae and like the posterior thoracic wall, and some muscles from our abdomen are actually going to pass under our diaphragm as well. So you can see in this like image over here how normally it's this curved structure when relaxed. Okay, when breathing it flattens to open up this space. Okay, does that make sense? So it like pulls, so imagine like your external intercostals are opening up your ribs, right? They're kind of like moving them out laterally. So then there's even more space, and your diaphragm is dropping down. So this whole space opens up so that your lungs can expand as air enters.